So this is the last presentation, I guess. This time I will talk a little bit about AI in whole body trauma scans and what we're doing with those ideas and where the limitations are. So what is the role of AI in trauma and emergency radiology? In general, if you look around, you will find things like this. This is from 2019. AI systems achieved cancer detection accuracy comparable to an average breast radiologist in retrospective settings, and has to be tested a little bit more. This was published in 2019. So there's always this threat, will AI replace radiologists soon? And rest assured, I will tell you a little bit, it won't. But nevertheless, here's another one that's just published in February. Our AI system matched radiology residents' performance, meanwhile significantly outperformed non-radiology resident diagnostic accuracy for most considered X-ray findings like pneumothorax, pleural effusion, and lung lesions. This was tested in an emergency room setting, and the conclusion is therefore it might serve as clinical decision support for non-radiology residents. So what's wrong with this? For me, the answer is very simple. AI will replace radiologists first who are not there anyhow. In other words, if there's no attending during the 24-hour coverage who generates a final report, of course people will look for alternatives. In general, I've written down a little bit how I think the development will happen. We are still in the screening phase. So the AI systems we have right now are more or less concentrated on extracting a certain feature out of our data sets, and we are away from having follow-up analysis, so longitudinal comparisons are still rare. They don't predict outcomes in most cases, and we are far away from autonomous systems where the AI does not only the detection of a feature, but also performs the entire exam. So it's a development that's going on, of course, and here's the different steps. I think the complexity obviously is getting worse. It's getting more complex the further you go down the development towards autonomous modalities and interpretation of the resulting images. And I think this is without any doubt the goal of these machines that are developed right now. A step beyond that, and I like that part also, is then to have autonomous interventions. So in other words, that the machine decides where to place, for instance, an IV line. So